Hello, Dr. and friends. We are from Group B10. We present our student project, Staphylococcus aureus infection induced septic arthritis, a bacterial-related musculoskeletal diseases. And this is our members.
Hello, my name is Ananta Wismaya with the last digit number of 198, and now I'm going to explain about our background on our student project. So, septic arthritis is an infection characterized by the invasion of the joint space and joint tissues by pathogenic microorganism. One of these microorganisms is a bacteria called Staphylococcus aureus, which is the most common infecting organism in adults. The incidence of septic arthritis is quite uncommon, which is between 2 to 6 cases per 100,000 people, but varies based on the presence of risk factors. Despite advances in the medical world, septic arthritis poses significant challenges in diagnosis, treatment, and long-term management. Through the findings from various research studies, the review aims to offer a deeper understanding of the complexity involved in the pathophysiology of septic arthritis and to identify areas for future research in managing septic arthritis. Hello, my name is Ananta Wismaya, the last digit number of 198, and now I'm going to explain some problem foundation on our student project. First of all what is the definition of septic arthritis? What is the epidemiology of septic arthritis? What are the risk factors of Staphylococcus aureus induced septic arthritis? What is the pathophysiology of Staphylococcus aureus induced septic arthritis? What are the clinical manifestations of septic arthritis? What are the diagnoses of Staphylococcus aureus induced septic arthritis? What are the differential diagnoses of septic arthritis? What are the treatment of Staphylococcus aureus induced septic arthritis? What is the prognosis of Staphylococcus aureus induced septic arthritis? And what are the complications of Staphylococcus aureus induced septic arthritis? There is also benefit of this student project is to increase the knowledge of the readers regarding general information about Staphylococcus aureus infection induced septic arthritis. It is also serve as a source of study for undergraduate medicine students. Additionally, we also hope this student project will contribute to science research in the future. Next is the general purpose of this student project is to know more about septic arthritis that is induced by the bacterium Staphylococcus aureus. And for the specific purpose is to answering all of the problem foundation.
My name is Dewa Angelica Utami with my last digit of my name is 098. So I will explain about the definition of septic arthritis. Septic arthritis is a serious inflammation in the joint space caused by infection of the pathogens that penetrate to the joint space through bloodstream or injury. Septic arthritis is an orthopedic emergency. Thus, it should be treated as soon as possible. The most common cause of septic arthritis in all age categories and risk groups is Staphylococcus aureus. Staphylococcus aureus is the part of normal flora in a human that mostly colonize the anterior nares and skin. However, when this bacteria spread in the body through the blood and into the joints, there will be inflammation in the joints that called septic arthritis. That's all from me. Thank you.
Okay, thank you for the opportunity. My name is Valentino Chandra Wijaya with relationship order number 116, and I will explain about the epidemiology of septic arthritis. Septic arthritis is a disease that is quite rare. In general, the disease can be found in 1 to 35 cases in 100,000 individuals. Septic arthritis is more common in men than women with a ratio of 2 to 1. Large joints such as knee joints are more often attacked by knee disease than small joints. Diseases can be found by several bacteria, but Staphylococcus aureus is the most frequent cause of disease. And septic arthritis occur more often in children than adults, especially in children aged 2 to 3 years. And in adults, diseases more often attack adults over 80 years old. Thank you.
Okay, now we will talk about Staphylococcus aureus and its affinity on human joint. Before that, let me introduce myself. My name is G Mahapraja Divasta with my 3 last ID number 02H. So, Staphylococcus aureus is a gram-positive bacteria that is cocky-shaped and arranged in grape-like cluster. Its virulent factor can be divided into cell wall components, surface proteins, secreted proteins, and toxins. From the table, we can see many kind of those virulence factors, which is most of them can cause septic arthritis. Okay, we'll talk about the Staphylococcus aureus affinity on human joint. Interaction between von Willebrand factor and also von Willebrand binding protein is thought to be main factor in increasing Staphylococcus aureus affinity in joint. Also, there is a lipoprotein virulence component, which is a TLR2 agonist, which is when the TLR2 receptor interaction occurs, there will be release in chemokine and also cytokine, which is induce the inflammatory process in human joint. One more, there is a bacterial biofilm formation in the site of an injury, which is a function in the increasing the protection of the bacteria from the therapeutic agent.
Hello, my name is Natasha Putri with the last 3 digits of my student number 083. Now I'll explain about the 3 factors of septic arthritis. General risk factors for developing septic arthritis include age over 80 years old, diabetes mellitus, pre-existing joint disorders, joint surgery within 3 months, hip or knee prosthesis, repeated injectable drug use, and HIV infection. In septic arthritis caused by Staphylococcus aureus, bacteria will have open access to multiply and spread to other organs if the patient has an immunodeficiency. A higher rate of infection also related to antibiotic resistance as a result of an adverse reaction to the initial medication and repeated injection drug use, as there is increased risk of already infected needle. Social problems such as inadequate initial therapy and lack of insurance coverage were also additional risk factors. That's all from me, thank you.
Hello everyone, my name is Cendrawan Han Santoso with the last 3 digits student number 170. Pathophysiology of Staphylococcus aureus induced septic arthritis. Staphylococcus aureus induces septic arthritis hematogenously in 70% of septic arthritis cases. Other methods are through direct trauma and spread from neighboring infection. There are 4 mechanisms in which the severity of septic arthritis is determined, which are joint affinity, biofilm formation, microbiome community, and exaggerated immune response. Joint affinity is the association on the host expression of von Willebrand factor and how it interacts with von Willebrand factor binding protein, which is produced by the Staphylococcus aureus. Biofilm is the formation of multicellular bacterial community that is held together by the extracellular matrix. Formation of biofilm renders antibiotic treatment useless and host defenses such as neutrophil unable to phagocytosize. Microbiome community is the diversity of microorganisms and their environment in our body. It can help stimulate the host immune system to prevent invasion of pathogens and infections. An exaggerated immune response often cause irreversible joint damage and permanent joint dysfunction in 50% of patients. Antibiotic killed Staphylococcus aureus cell wall components still trigger the immune response and activate osteoclast that leads to bone destruction due to excessive resorption. A combination of antibiotics and immunomodulatory therapy can help reduce the risk of permanent joint destruction. Thank you.
Good morning, doctor. Good morning, everyone. My name is Kadek Asri Bintari with the last 3 digits of my student number R063. Today, I would like to explain about the clinical manifestations of septic arthritis. The clinical manifestation of septic arthritis can be divided into 2 groups consisting of local symptoms and systemic symptoms. The local symptoms in cases of septic arthritis are identical to the sign of inflammation in general, which can include warmth, redness, edema, pain, and decreased joint function or limited joint movement. Next, the systemic symptoms found in cases of septic arthritis are fever, increased heart rate beyond normal limits or tachycardia, irritability, and decreased appetite. Okay, that's all from me. Thank you.
My name is Jile Fitria Ateta Ginting with the last region number 140, and I will be explaining on how to diagnose Staphylococcus aureus-induced septic arthritis. So the main diagnostic tool is synovial fluid studies, but before that we can do some assessment to consider a few factors such as the clinical history, previous exposures of the patient, the clinical manifestations based on physical examinations. And we can also use laboratory tests such as erythrocyte sedimentation rate and C-reactive protein to rule out the arthritis with other type of arthritis. And the result should be ESR being more than 10 millimeters per hour and CRP more than 1.5 milligrams per deciliter. And it will be most likely septic arthritis. And after that, we can proceed with the with synovial fluid studies with white blood cell count of differential, gram staining, culture, and crystal analysis. And for gram-positive bacteria such as Staphylococcus aureus, the result should be yellow-green color, opaque, very low viscosity, white blood cell count more than 100,000, positive gram staining and cultures, and no crystals. And to take up this synovial fluid, it is using a method called arthrosynthesis. And it is also important to note that plain radiographs and ultrasonography cannot be used for diagnosing. And that is all from me. Thank you.
Hello, my name is Lyshanda Bianca Kusuma with the last digits of student ID is 025. Now, I will explain about the differential diagnosis of septic arthritis. The presence of septic arthritis symptoms, which are common with many other joint disorders, can complicate the diagnosis. The differential diagnosis of septic arthritis includes crystal-induced arthritis, avascular necrosis, tumors, osteomyelitis, ancient synovitis, and inflammatory arthritis such as rheumatoid arthritis and reactive arthritis. Here are the explanations for some of these. 1. Crystal-induced arthritis. Good and pseudo-good can mimic the clinical manifestation of septic arthritis. Analysis of synovial fluid can rule out crystalline arthritis in the joint. However, the presence of crystal doesn't exclude the possibility of septic arthritis. 2. Reactive arthritis. Symptoms of both reactive arthritis and septic arthritis can be similar. In contrast to septic arthritis, the result of synovial fluid culture of reactive arthritis are negative, indicate that reactive arthritis is caused by either an overstimulation autoimmune response or deposition of bacterial antigens in the joints. 3. Transient synovitis. This condition may present initially like septic arthritis and create a diagnosis dilemma. Clinical signs that differentiate transient synovitis from septic arthritis include CRP greater than 20 mg per liter, ESR levels greater than 40 mm per hour, and previous weight-bearing limitation. Thank you, and next slide.
Good morning, doctor and also friends. My name is Praditia Putri and my last 3 digits of my student number is 067, and today I'm going to explain about the treatment of Staphylococcus aureus in the septic arthritis. So the primary goal of this treatment is to remove infectious bacteria using antibiotics. One of the example antibiotics that can be used is intravenous vancomycin, which is typically used as an empirical antibiotic for non-local septic arthritis, particularly in cases where community and institutional data raise the possibility of methicillin-resistant Staphylococcus aureus. Also, ceftriaxone, ceftazidime, or cefotaxime are the examples of third generation of cephalosporins that should be administered for further gram-negative coverage in cases when the patient is immunocompromised, abusers intravenous medication, or the gram stain is negative. But if one condition appears, like if organ dysfunction occurs during infection, supportive care is required to preserve homeostasis or the balance in our body. Prevention options are isolating patients who spread bacteria in hospital settings and eliminating staphylococcal colonization in high-risk groups with harsh chemotherapy. It is also recommended to re-aspirate the joint if no improvement is observed in 5 to 6 days, and to avoid muscle atrophy and restore joint function, aggressive physical treatment is required. That's all from me. Thank you.
Thank you so much for the opportunity. First of all, let me introduce myself. My name is Rahel Manurung with the last digit student ID 030. So in this video, I'm going to tell about the prognosis of the Staphylococcus aureus induced septic arthritis. So Staphylococcus aureus induced septic arthritis is linked to a high rate of morbidity and also mortality because of the irreparable joint injury and the cartilaginous collapse. The other factors that contribute is age, comorbid diseases, and previous use of synthetic intraarticular material. The mortality rate for the septic arthritis is 7%, and it rises to 22 until 69% in patients 80 years old and older, whereas the morbidity happens in 1/3 of the cases. One of the common comorbids in septic arthritis patient is rheumatoid arthritis, that's shown have 1.88 ratio higher risk of serious infection that need hospitalizations than the rheumatoid arthritis due to the immunocompromised state or the immunosuppressive therapy. The poorer prognosis is also found in septic arthritis that affects the large native joint rather than the small relative joint septic arthritis due to more time spent on the antibiotic therapy. And about 24% to 33% of the patients with septic arthritis experience poor functional results, which include amputation, arthrodesis, prosthetic surgery, and also severe functional decline. That's all for me. Thank you.
Okay, thank you for the opportunity. Let me introduce myself. My name is Hannah Clara Stanadin with my 3 last digit number of student ID number is 236. And now I'm going to tell about the complication of septic arthritis. There are several of complications in septic arthritis. There's osteomyelitis, chronic pain, osteonecrosis, leg length discrepancies, sepsis, and death. Osteomyelitis is an inflamed bone and structure caused by various types of organisms. Organisms that could cause it are bacteria, fungi, and mycobacteria. Infected bones can spread to other parts of the body directly from an injury or surgery. Next one is osteonecrosis or avascular necrosis or AVN. It is a condition where cellular part of the body dies due to limited blood supply to the subchondral bone, and it is most likely to happen in the head. Next one is the length discrepancies. It could possibly happen when there's an injury or bone loss that leads to one leg becomes shorter than the other. The patient's body will lean more towards the short leg because of lack of body balance. And the last one is sepsis. It is a life-threatening dysfunction organs, and it's a condition due to an infection caused by uncontrolled immune response. There's various musculoskeletal symptoms resulting from sepsis. There's crepitus, joint swelling, and weaknesses, and there's many more. Maybe that's it for me. Thank you.
My name is Nadya Ernestine, and the last 3 digits of my student number are 155. So from this literature review, we can conclude that septic arthritis that is caused by Staphylococcus aureus invading the joint space poses a serious health threat. Staphylococcus aureus, a gram-positive bacterium, is a common cause behind this condition that can affect both of the joints and causing severe infections. The risk factors include immune disorders, old age, and certain medical procedures. Septic arthritis can cause rapid joint destruction, especially in the elderly, with significant morbidity and mortality rates. Rapid diagnosis and treatment are also essential to reduce complications and improve the outcomes. This marks the end of our presentation of our literature review titled Staphylococcus aureus, Infection-Induced Septic Arthritis, a bacterial-related musculoskeletal disease, and we really hope that this literature review could give all the viewers a lot of insights about the topic. Thank you.